had our laser for about 18 months.
And what kind of conditions have you been using it on?
We use it primarily on our orthopedic conditions. We use it on all of our post-surgical orthopedics for 6 times. We do use it also on lick granulomas. We use it on chronic back pain dogs. We use it on any kind of post-surgical thing that's getting some swelling, and we definitely use it on the gums of teeth post-extraction. And the cats that get full mouth extractions, there's a wild difference in 24 hours on the cats that get the laser versus the cats that don't. Mostly on the inflammation in the gums. It's tremendously different.
So can you tell us a little bit about the results you've been seeing that you've gotten with laser that you haven't been able to get before?
I think one of the biggest results is in our TPLOs. We do 2 to 3 TPLOs a month in our practice, and we have done that consistently. We use the laser 6 times post-surgically. At 1 week post-surgically, we're no longer having any edema in the hocks, and at 1 week the incision looks healed. We're being conservative and taking out the sutures at 10 days. We no longer have inflammation of the staples. We aren't losing staples in the incision any longer. We haven't had a single incision infection. The dogs lick the incision way less than previous, and we've also found that most of the dogs have a more rapid healing rate, and most of the dogs are healed at 12 weeks as opposed to 14 to 16 really rapidly.
Wow, that's a big change. So how have your clients accepted the therapy?
From a orthopedic standpoint, we explained to the client why it's on the estimate, and it is included in the initial orthopedic estimate, and they do pay for it all up front at the time when they pick up their pet from the surgery, and we haven't had any problem with acceptance with it. Sometimes for some therapies where we're not sure whether or not it'll be effective, we will, instead of doing a package of 6, we'll do a package of 3 and explain to the client that if they're not seeing obvious improvement, then there's no reason to go on. We frequently take it in the room with the clients, or for our dogs that are post-surgical that we don't want on the linoleum floor, we take it outside, we do it in people's cars. They love it.
Cool. Is there anything else you'd like to share with people about companion therapy laser?
I think that it's a bit of an investment to start with, and it is something that you have to get in the practice of using and remembering to offer. But I do think from a post-surgical healing standpoint that it has a lot of applications in practice, and clients really do accept it.
That's great. Thank you so much for your time.
You're welcome.